Hi friends, thank you so much for supporting academia, and today we want to consider mental health. Okay, mental health, and we want to do multiple choice questions. So thank you so much again, and those of you want to join our WhatsApp group academia, please, you can contact us where we do NMCZ questions every day. Okay, so if you want to miss, don't join. If you really don't want to miss, please join. Let's do this together, and so that we should acquire that which is okay. Now, coming back to mental health, now we have tried to a little bit change the questions. Okay, we have touched there a little bit here and there to say, at least to have the broaden and the new idea to some of the questions that we have a little bit manipulated. Okay, so the first question says, a thought, or rather thought process characterized by a series of ideas without apparent logical connections is referred to as. The answer is A, loosening of association. Now, what is the rationale to that? Loosening of association, we can just say it is a thought disturbance, okay, demonstrated by speech that is disconnected and fragmented, with the individual jumping from one idea to another, unrelated or indirectly related idea. That is what we can actually, so the answer is A. We go to the second one. The second one says, which among the following is not a short-acting benzodiazepine? All right, so the answer is B, diazepam. Why? Or rather, what is the rationale? The rationale is very simple. It is a long-acting benzodiazepine. Okay, that is a very long-acting drug to say. Okay, we go to the third one. The third one says the therapeutic serum level of carbamazepine is. So the answer is B. Okay, it is B, which is 6 to 12 microgram per deciliter. All right, it is B. Then we go to question 4, which says first line drugs for the treatment of mania is, or rather are. So to question 4, we are given those particular options. So the correct answer is both of the above. Both of the above, meaning 2, where we have lithium and valproate, okay, or valproate. So both of the above, which is C. That is the answer. Now, what is the rationale to this? The rationale is that, the current practice guidelines state that the first line treatment for severe manic or mixed episodes is either lithium plus an antipsychotic or valproate plus an antipsychotic. All right. While for less ill, patients, monotherapy with lithium, valproate, or an antipsychotic may be sufficient. So that is basically the rationale to that particular question. All right. We move on. Question 8. Yeah. Question 9 says fear of pain is termed as what? The fear of pain is called agoraphobia. Okay. The rationale is that zoophobia is fear of animals. Agoraphobia, or rather agoraphobia, is fear of open spaces. All right. Then xenophobia is fear of strangers. That is what we can actually explain. So the answer would come out as agoraphobia, right? Agoraphobia. Okay, we carry on. Question 10 says the habitual tendency to be anxious in general is called what? Now, understand this question. It says the habitual tendency to be anxious is in general is called what? So the answer to this is trait anxiety. What is the rationale? Now, trait anxiety refers to the stable tendency to attend to, experience, and report negative emotions such as fears, worries, and anxiety across many situations. All right, so that is how we can explain it. We carry on. Question 11 says, how does norepinephrine relate to depression? The answer to this question is, it's decreased in depression. That is decreased in depression. Okay, it decrease in depression. So the answer is A. Okay, decrease or decrease, okay, in depression. Okay, so the way we can explain this question is that this particular hormone helps to mobilize the brain for action and can improve energy and attentiveness, which in turn found to be decreased in depression. Yeah, yes. Okay, so that is how we can explain it. Okay, question 12 says, an increased sense of psychological well-being and happiness not in keeping with ongoing events is called. To this question, the answer is euphoria. Okay, euphoria. Now, euphoria is the experience, or rather the affect, okay, of pleasure or excitement and intense feeling of well-being and happiness. It is called euphoria. Okay, which is answer C. Carry on. Question 13. It says, exaggerated self-importance is a feature of which delusion? Question 13. So we are saying exaggerated self-importance is a feature of which delusion? So the answer to that question is it's B, delusion of the grandeur. It's actually B. Okay, and the rationale to that is that a delusion of grandeur is the false belief in one's own superiority and greatness, or rather intelligence. Okay, okay, we carry on. We go to question 14, where it says, first discovered tricyclic antidepressant is. So looking at the options, we've got those ones, and the best answer is imipramine, which is B. And the rationale to that is that imipramine was discovered in 1951 and was introduced for medical use in 1957. Okay, that is what you must know, and it falls under tricyclic antidepressant. Right, so remember that. So which is B. Okay, we move on to 15. So under 15 it says, which among the following types of schizophrenia thought to have the worst prognosis? Okay, so to question 15 it says the answer is hebephrenic, which is B. Let me try to explain this one. Now, the hebephrenic or disorganized subtype of schizophrenia is actually typified by shallow and inappropriate emotion responses, foolish or bizarre behavior, okay, false beliefs, or delusions, and false perceptions or hallucinations. That is how we can explain hebephrenic. So looking at the nature of the question, which says which among the following types of schizophrenia thought to have the worst prognosis, the answer is B, hebephrenic. That is the answer. We carry on to question 16, where it says delirium tremens usually starts how many days after the last drink of alcohol? Okay. It is 2 to 5 days. 2 to 5 days, which is A. Okay, 2 to 5 days. Now, someone may ask for the rationale. So the rationale there is that delirium tremens, which is DTS, okay, is a rapid onset of confusion, usually caused by withdrawal from what? Alcohol. All right. All right, we carry on. Question 17, which says disorders of adult personality and behavior is classified under ICD-10 in what? So the answer to that is actually 60 to 69. Okay, 60 to 69, which is D. All right, under ICD. We carry on. Question 18 says techniques, okay, used in psychoanalytical therapy are what? So they are looking at now the technique which are basically used under psychoanalytical therapy are what? So the answer is all of the above. Okay, all of the above, which is D, where we have free association, hypnosis, and the reaction therapy, and so on. So all of those, they are actually used. Now, under what is called catharsis and dream analysis, to say, also are techniques of psychoanalytical therapy. Those are addition to that. Okay, if I remember very well, those basically are addition to that. Okay, we carry on. Initial dose, that is 19, initial dose of diazepam, okay, in the treatment of alcohol withdrawal is what? The answer is 500 milligram. Okay, milligram, 500 milligram, which is D. Okay, which is D. And what you must know that is that, what you must know in that is that initial dose is 500 milligram per day orally for the first 2 weeks, followed by a maintenance dosage of about 250 milligram per day. It should not exceed 500 milligram per day. It shouldn't. Okay, it shouldn't. Okay, we carry on. We go to 20. 20 says magical thinking, peculiar notions, ideas of reference, illusions, and derealization are part of which personality disorder. Okay, so the answer would be schizotypal. Okay, schizotypal. Let me try to explain. Persons with schizotypal personality disorder are, strikingly odd, or rather odd, or strange, even to lay persons. Okay, so the answer there, it would be schizotypal, which is basically C to that question. Okay, we carry on. 21 says which among the following is the first generation of antipsychotic? Okay, so the first generation of these drugs is that they are called chloropromazine. Okay, promazine, which is C. Sorry for that. Okay, then we carry on. So under these, the other options are second generations, which are antipsychotic, these others, but C basically is the first generation of those particular drugs, so followed by these, which are in the second generation. All right. Okay, we carry on. 22 says an example of a non-therapeutic communication technique or techniques is what, which is 22 there. The answer would be, okay, belittling. Okay, belittling, which is B, belittling. Now, what do we mean by this? So the other options, basically they come, but we normally don't use them as in terms of the way the question has been phrased. So the answer to that is belittling. Now, how can we understand this, or rather, what is belittling? So belittling is actually the language or behavior that, literally makes someone feel small, unimportant, or inferior, or minimized. Okay, or minimized. So to belittle someone, belittling, right? Kuchita belittle umuntu filia como you want to young someone. Okay, carry on. So 23, most important factor in a therapeutic relation is what? The most important factor in a therapeutic relationship is what? The most one is trust, actually. When you break trust, you've broken everything. Okay, so without trust in a relationship, there is no relationship. Trust is one of the most important aspects of a relationship. That is what you must know. So the answer is A. We carry on. 24, it says the involuntary blocking of unpleasant feelings and experiences from one's awareness is known as what? So to 24, the answer would be the involuntary blocking of unpleasant feelings. Involuntary blocking of unpleasant feelings and experiences from one's awareness is known as what? Yes, the answer is repression, which is B. Repression involves placing uncomfortable thoughts in relatively inaccessible areas of the subconscious mind, to say. Okay, so we'll go for B, regression. So basically, that is it. Okay, we carry on. 25, generativity versus stagnation is a psychosocial crisis of which age group? So to that question, we discovered to say it is for adulthood. Okay, which age group? Adulthood, which is C. So what do we really mean under adulthood? 40 to 64 years of age are categorized in this stage group by this man called Erickson in stages of what? Development. So the answer is C. Okay, then 26 says in which defense mechanism anxiety is expressed through physical symptoms. So the answer is conversion. Okay, conversion, which is B. So what do we mean by that? So conversion as a defense mechanism occurs where cognitive tensions manifest themselves in a physical symptoms. So the symptom may well be symbolic and dramatic, and it is often acting, or rather acts as a communication about the situation. So extreme symptoms may include paralysis, blindness, deafness, becoming mute, or having a seizure. So basically it's really conversion. Okay, and there we go, which is the last one. Drug of choice to reverse the dystonic reaction is what? So the answer would be diphenhydramine. Okay, which is B. So basically this particular drug is about 25 to 50 gram IM or IV, and is used to revert dystonia. Okay, to vet it in that way. Otherwise, thank you so much, and this is what we prepared for you, or rather I prepared for you. God bless you, and you're wonderful people. Thank you so much, and love you all.